Everyone in Israel thinks, 8,200 innovation. I don't think anyone thought that out of the canine unit of the IDF. You'd say, okay, let's at least diagnose cancer.
The dog's sensitivity, it's part per trillion. So they can sniff one part out of trillion parts.
Wow.
So just if you take like a half a spoon of salt or sugar, put it in an Olympic swimming pool, they can tell the difference between these two different pools.
And you say, here, take a mask, breathe into it, you may have cancer. So you're a scientist and not a commercial guy. Is that beneficial or a drag on being the CEO of this company? Like, I got emotional in the middle of talking about my friend Ty, who was just diagnosed with kidney cancer not long ago. So Ty, this one's for you. Hope you're listening. Welcome back to another episode of Invested. I almost feel like this episode of Invested is a cross between National Geographic and Wired magazine. You see, we live in a world where we think about intelligence in terms of artificial intelligence today. We often think about human intelligence. What we don't realize is that all the species around us have their own intelligence, and they've evolved and developed in very, very different ways. Our guest today on Invested is Shlomi Madar, the CEO of a company called SpotitEarly. SpotitEarly asked the question, what if I take the highly evolved sensor called a dog's nose, married it to digital and artificial intelligence, and use human dog training and human intelligence in trying to detect cancer to merge all these things together and create the world's greatest cancer detection system? It is a remarkable merging for the time we're living in of thousands of years of evolved canine intelligence, thousands of years of evolved human intelligence, and a decade of digital intelligence. I think you really enjoyed the episode with Shlomi, the CEO of SpotitEarly. So there are other ways to look for cancer. There's CT scans, there's drawing blood, etc.
Yeah.
There's a famous woman named Elizabeth Holmes, or an infamous woman named Elizabeth Holmes.
So I hear.
Yeah, who made similar claims about being able to detect or diagnose cancer, among other ailments, and by drawing blood or drop of blood. And here you come with dogs sniffing cancer. And so why should people assume that this is actually real, given, call it, the fraud in the background from Elizabeth Holmes?
Sure. So it's a great question. And I think, it's very easy. It's very simple. The proof is in the pudding. So for the company that she started, first of all, it wasn't just cancer. It was a whole host of different diseases that we was claiming to identify, but also they didn't have double-blind clinical study where it's really hard to manipulate the results. And we've done that. We completed a trial with 1,400 patients where it was double-blind. It means that you deposit your predictions in a third-party company, and then they do the big reveal. So you cannot go back and forth with your predictions. So that would be my kind of straightforward answer. Why are we different than them?
Okay. Has there been scientific literature published on your accuracy statistics?
Yeah. In a peer-reviewed journal, Scientific Reports. It was published, I think, at the end of last year.
Okay. How does it work?
All right. So maybe we do a little bit of a background. I think it's important just to figure out what's going on there. So as you mentioned, also by training, I am a molecular biologist, so I'm going to get a little bit technical. I'll try to keep it
No, it's okay.
level.
We have a very intelligent audience.
Oh, that's great.
Yeah.
Good to know. So basically, we are focusing on something called volatile organic compounds, or VOCs in short. And these molecules are information, if you will, about what's going on inside of our bodies. So it's not necessarily limited to cancer. Any biological process that's happening is reflected in those VOCs. The way to capture those, so they are circulating in the blood and they are exchanged in the alveoli, in the lungs, into the air that we exhale, the air that we breathe. And what we do, we capture, so I have a mask here with me just to show you how simple it is.
Live demo.
Yeah, live demo.
Yeah.
It looks like an N95 mask, so it's very, very simple.
Yeah, everyone now knows what N95 mask is since COVID. Yeah, so, right, okay, so you have a mask.
Yeah, and we don't ask people to put it on for 3 years, just 3 minutes. Okay?
How long?
3 minutes.
3 minutes, okay.
You breathe into the mask freely for 3 minutes. You can scroll on your phone. You can read a book. Maybe it's better to read a book, but only 3 minutes. You put it back. You finish breathing into the mask. You open the capsule. You put it inside, and you ship it back to the lab. Okay. So now what happens is,
And that is a fully sealed container that
yeah,
nothing else can get into. So whatever I
right.
breathed into the mask over 3 minutes is what will stay in the mask until it gets to its destination.
Not only that, these are very durable, and the VOCs actually they are being kept in this mask for at least a year.
Wow.
So we've done a lot of pressure testing, temperature testing. It's very durable, and it's important because
So even if it goes to the Israeli mail system, which could take it a very long time,
yes,
it will end up still being useful even after a year.
even the American
Mail
mailing
system.
So
Yeah.
together, yeah,
Yeah, when, if it gets lost with Santa's elves, you'll still find it, right? Okay.
exactly. So what we do in the lab, we know how to extract those remember the VOCs that we talked about.
Volatile organic compounds.
Wow, you're a great student of biology. I love it.
Yeah, I haven't taken biology since the 11th grade, but okay, go ahead.
So we know how to produce gas from this mask, and in this gas you have those volatile organic compounds, and we know how to introduce those compounds to the sniffing dogs. Okay, so this is just to give you kind of a quick look into the beginning of the process.
Mm-hmm.
So in the lab we have what we call the sniffing ports.
Mm-hmm.
So these are actual physical ports where we introduce the gas to the sniffing dogs. The dogs were trained to sniff specific cancers. So we have a pack for breast cancer, a pack for lung cancer, and so on.
What kind of dogs are these, by the way?
Oh, yeah. So they're amazing beagles.
Beagles.
And by the way, all dogs are amazing. It's important for me to note that. The beagles are best for this particular task because of their demeanor. So they're very independent. So they don't have to look back just to see if their handlers are happy, which is super important because of what comes next, which is the AI.
Mm-hmm.
Also, they're great sniffers, but I can say that about other dogs as well. But they are amazing sniffers, and they're very sweet.
Now, how'd you know to start with beagles?
We didn't actually start with beagles.
Who'd you start with?
Labradors.
Labradors.
Yeah, and they are amazing. I don't want to.
You don't want to badmouth the Labradors.
Yeah, oh, no.
Okay.
I don't want to talk smack about them. I love Labrador. I love all dogs, to be honest.
I'm not a dog lover.
I mean, we can fix that.
Okay.
But and by the way, some of the dogs don't pass our test, and then we donate them. So maybe we can talk about that later.
Yeah, who do you donate them to?
Typically, families with kids with special needs.
Mm-hmm.
Some of them were actually adopted by our employees.
Got it. So
Yeah.
okay, so now you got beagles. The Labradors didn't make the cut, so you went to beagles.
Yeah, but I'm saying also not all the beagles would make the cut.
Okay, and what caused them to fail?
So there are a couple of different things. It could be, first of all, just the sniffing, so that the professional thing that we need from them, but also their demeanor. It's also important for them to be very independent and active and know how to work in a group. Remember, they live together, they work together. So our trainers would know how to look at all these different aspects.
One of the things, by the way, I'm going to ask our team to do, and I'm encouraging anyone listening to this on Spotify or Apple to actually look at the YouTube video. We're going to hopefully run some B-roll while this is going on of the dogs going around and sniffing.
Yeah. Now, these dogs were trained to sniff this particular scent of that cancer. So their gesture is sitting. So it's very simple, relatively speaking. But using dogs just with this gesture and having a handler interpreting their gesture is good, but it's not great.
Okay, so just wait a minute. The dog goes around. It sticks its nose into wherever it sticks its nose.
Yeah.
Some cone. It gets a whiff of the VOCs. And if there's cancer from that sniff, it sits down.
Right.
Okay.
I do have to say, you'll see it in the video, hopefully. But this is not just us giving a mask to the dog. There is a whole technology platform here. We call it Lucid. So it controls the whole process end to end. So starting from the information of the patient and kind of knowing to receive a mask, producing the gas, everything is controlled by this Lucid. It's like kind of a brain that controls everything, but it also has hardware. So it introduces the different controls and the sample, the target sample, to the dogs in different order, so they don't get used to the same sniffing port being positive or negative.
You have to randomize it.
Yes.
Okay.
And we actually let the dog sniff the sample more than once.
Mm-hmm.
So we have some redundancy baked into the process.
Mm-hmm.
And another redundancy level, and soon I'll explain why it's important, we're using the whole pack. Remember, you see it in the video, it takes less than a second to clear a sniffing port for the dog. So it's very, very quick. But there are a lot of different types of information that are being collected during this process. And this is where the AI comes in, okay? So the AI has kind of eyes and other sensors, and it knows how to interpret what it's seeing, basically. So I'll give you a sense of what we're talking about when we talk about sensors. We have cameras on top of the lab. We have cameras inside the sniffing ports, so they can actually monitor the facial gestures of the dogs, which is very important. We also have a small microphone embedded in the sniffing port, and it actually captures the breathing pattern of the dogs. And remember, this is another kind of indication as to what the dog is actually sniffing, whether or not it's sniffing in a certain way. So
the dog sniffs and has different breathing pattern depending on whether there's cancer in the sample or not cancer in the sample?
yes, so you can find those nuances.
And they make a different face depending on if there's cancer on the sample or not?
Yes, also more than that, I will say it's some of these gestures are involuntary. So basically the dog doesn't even know what is gesturing, but through the machine learning, who was trained to identify different behaviors of dogs, and also they know intimately the actual dogs in our lab. So they know what's kind of their baseline. And whenever they're deviating from the baseline, they know how to kind of quantify it.
Okay.
So I mentioned this sensor. There's also, the dogs are wearing a vest. In the vest, we've embedded sensors. So we're measuring both their heart rate as well as their acceleration. So we have accelerometers hidden inside the vest. Now, just imagine that all this plethora of information is being kind of fed into the machine learning algorithm. And just to give you a sense of what type of information we're talking about here. So let's just focus on the video. So every sniffing event is being captured in a short video. So you take this video, you break it down into frames, every frame into pixels. And that's what actually the machine learning is analyzing. And this is just one sensor that I mentioned. So because it knows the baseline of the dogs, because it was trained basically to identify a different dog's behavior, it can really tell you what's the true meaning of the gesture of the dog. So it doesn't only focus on the sitting. The sitting, it's nice, but it's very crude.
What if you get the 94% accuracy, what percentage accuracy do you get to from sitting?
So it's hard for me to answer this question because when you talk about the 94%, it was a year ago.
Got it. Now
Since then, we have like different type of packs. We're using different type of sensors, so it's not apples to apples.
Okay, what is it now, you think?
So I would say it's around 80%
Accuracy.
before you apply the machine
AI.
learning. Yeah,
And
I
then-
think
And once you apply the AI or the machine learning, then you get to
over 90%.
well over 90%.
Yeah.
Okay,
Yeah.
like 91% or 97%?
It varies
on the
between the
cancer.
cancers, and also it needs to be done under. Right now, it's single blinded because we're not still in the clinical settings, but we want to make sure we repeat it in the double blind setting.
Yeah,
as
but
well.
even if, I guess I'm just thinking about this now, even if it's 90%, right, it doesn't tell you you have cancer. It tells you 90% that you likely have cancer.
Oh,
Now
yeah.
go get it checked out with a blood test or something else.
Oh, let's take a step back.
Okay.
So no one screening tool is 100%.
Right.
It doesn't exist. So
Even blood.
even blood. I
Yeah.
mean, I would say more. And blood test is not the golden standard at all
Right.
for diagnostics.
Mhm.
So maybe a little bit of information about blood tests.
Yeah, go
Okay.
ahead.
So when we talk about screening tests, there aren't that many. So the scheduled routine screening, we're talking about only 5 cancers. And this is true both for Israel and the US and around the world as well. So the big 4, right? We have prostate, we have colorectal cancer. Prostate, we have PSA typically. That's a blood test, for example. We have colonoscopy for colorectal cancer. We have mammograms for breast cancer. We have low-dose CT for lung and Pap smear for cervical cancer. These are the 5 that are being currently tested, and they're not all created equal. So not all of them are, first of all, many of them are very invasive or uncomfortable at least. So
And
it's
they
not,
don't always catch cancer at early stages, all these.
exactly. So
Right.
that was where I was heading.
Mhm.
So you mentioned blood tests. So the old blood test, let's take the PSA, for example. So it doesn't really identify prostate cancer per se. It knows when the prostate is being enlarged, it's enlarged for whatever reason. So it could be kind of a benign, what you call benign hyperplasia, which is just a benign growth of the prostate gland. It could be inflammation, but it gives you a sense that something is off. with the prostate cancer. But it's just the first indication, and then you have to go through additional testing. Could be biopsy, it could be digital exam, whatever it is. And the new blood tests are actually they're better. So they're looking across the board, what we term as omics. So you probably heard about genomics or proteomics. So it's true for other types of information that you can glean from the blood. From stool, it could be metabolomics, for example. So it's very informative in a way, but it's still not that accurate for early stages. So I'm going to give you an example. One of our biggest competitors, who's also, I have to say, I kind of tip the hat to them. They're called Grail. So they developed this multi-cancer test that can screen for 50 cancers at a time, which is amazing. They kind of opened the door for this trend of tests that will screen for more than one cancer.
Like the Holy Grail.
Yeah, exactly.
Yeah.
The problem with the Holy Grail, and again, there is merit to screening 50 cancers. The problem with Grail currently, it's not excelling at the early stages.
What does that mean?
So most cancers have stages, stage 1 to 4. Typically, there are other ways, by the way, to grade cancers that are very specific, but I don't want to get into that. Let's focus on the stages. Why is it so important to excel at the early stages? So, on average, across all cancers, if you detect cancer early enough, so stage 1, you have more than 90% survivability rate, okay? And for some cancers, it's even more. Like for breast, it's 99%. Just let this number sit with you for a second. So there's a world of difference between stage 1 and stage 3. It's not just to survive it, right? It's the type of treatments you have to undergo.
So
it's
you're
the quality
saying
of life.
the Grail,
Yeah.
just to make sure I'm clear,
Yeah, of course.
does a poor job, even if you take their test, they do a poor job of catching cancer in the early stages where it's most curable.
Right.
Okay.
Exactly. And again, I'm not saying there's no merit
I got it.
in other stages across the
You're not
board.
completely dissing them, but you're suggesting that, if you want to get early diagnosis and survive, you probably should do something else.
Yes.
Okay. But I will tell you that they do a better job of naming their company than you do.
Well, that's that's arguable.
I get it. Spot, cute, the dog. I got it. This is the right time to talk about early detection.
Yeah.
Still?
I mean, listen, early, it's...
See how many words there are on your shirt? It's like a lot for a company.
Yeah, but we've broken it down into two rows, no?
I
Doesn't
see.
do it for you?
All
right, we'll have to figure out
you got
the
the X
branding
marks,
soon.
the spot. That's not exactly what I have in mind when I think about spot, like the dog. I don't know. Why is there no dog on your shirt?
I mean, listen, there's going to be a few variations of our, our shirts and other kind of,
All right, get me the one with the dog on it. Even though I don't like dogs, at least it's better on brand, I think.
I'll take a note of that.
Yeah. Israelis are very good at the science, less good at the branding.
That's true.
Yeah.
We are working now with US marketing and PR teams, so hopefully we'll get better.
All right, good. All right, so back to SpotitEarly now.
Yeah.
So, okay, so you detected early. How? Why? How does this work?
So actually, we're faring better compared to ourselves at the early stages. So which might be counterintuitive, right?
What it suggests maybe is that these VOCs are a better indicator than blood for early stage cancer. Is that fair?
Oh, that's for sure. But even when we compare to ourselves, so when I look at the sensitivity levels of stage 1 versus stage 4, we're actually doing slightly better at the early stages, which is counterintuitive. Why? Because as the tumor grows, you would expect it will produce more of the VOCs, right? So we don't know exactly what the reason for that. It's not, we're talking about a few percentage points, but it's repeating itself. We have a conjecture on why it's happening. So as the tumor grows, it forms what we call the tumor microenvironment. So perhaps it's a little bit masking the pure scent of the tumor for the dog.
Trying to hide itself.
Yeah. So, but again, it's just a conjecture. It's really hard to prove.
It's a cloaking device.
Maybe. Yeah.
Yeah.
Love it.
Okay. So, I'm just a regular person who lives in New York City, Chicago, Tel Aviv, Berlin. And I go to the doc and he says, take a test, a blood test, whatever it is. And maybe they send it and they discover, God forbid, somebody has cancer. When I'm 50, they do that colonoscopy thing, which is awful for 2 days. before you do the colonoscopy. But there's somebody who tells me, hey, go drink this stuff.
Yeah.
You know.
But the actual procedure itself, I mean, I
Yeah.
got 3 hours of sleep. I mean, that's not too bad.
That's one way to look at it. You know. I didn't feel the same way, but and I can use the sleep. Yeah. And like, how do I get to this mask, and why do I do this? And
Sure. So we're not in the market yet. It's important for me to know.
Yeah.
We're still under clinical trials. We do have a CLIA certified lab.
yeah, what is it, clear?
Exactly. So it's one of the regulatory governing bodies in the U.S.
Yeah.
It works kind of side by side with the FDA.
What does it stand for? Certified Laboratory.
Sorry.
Something.
Yeah.
Innovative Association, In-House Association. Yeah.
Yeah. Maybe we can fix that later.
All right. So it's alongside the FDA, which means it's a pain in the neck.
Yeah. I mean, they're more separated now than ever before. The FDA tried to sue them. It didn't go well. And I think now there's more separation there. And basically, it allows us to sell laboratory-developed tests outside of our lab. There are only 2 labs in Israel who are CLIA certified, and we're one of them. So we're very proud of that.
Congratulations.
Thank you so much.
I think.
Yeah.
Okay.
Yeah. So it means that we can sell the test in the U.S. So let's start with your question. Where do we sell it? Right now, we can only sell it in the U.S. The reason why we're not in the market yet is we just started a clinical study in the U.S.
Where?
In New Jersey.
Okay.
With in collaboration with Hackensack Meridian Health. It's the largest health system in New Jersey. It has 18 hospitals, a lot of clinics, great partners to us. And it's going really well. We're going to add additional sites.
I said I go to the hospital to go breathe in a mask for 3 minutes?
That's for the clinical study.
Oh, yeah. But what's like...
Yeah, I'm getting there. I'm getting to the market. I'm saying right now where we are, we're performing this clinical study. Once we have enough information collected from this, again, it's the same rigor, double-blind study. Once we have at least interim results from that study, then we'll go to market and sell directly to consumers.
Okay, directly to consumers. Like, but why am I going to know that I need this? And why should I even buy this? Like, I'm a guy at home in Chicago, and like, why am I getting a mask? Go breathe into it and send it to you in a canister so that you can tell me if I have cancer.
So I think you alluded to that. Some of the alternatives are painful.
But I'm not doing those either. Like, most people don't do these things. It's just, they don't do this.
Sure. So obviously it will depend on our marketing capabilities.
Yeah.
But the idea is to tell you, listen.
I mean, how good you are at getting people to take an unnecessary test.
It's okay. So let's maybe tease this out.
Yeah.
Necessary versus unnecessary. So I don't know if you guys are aware of it, but there is a very worrying trend where the onset of some cancers starts earlier than what. So it's hard for
some people even attribute it to the COVID vaccinations. I have no idea if that's true or not. But
the trend started before the COVID.
Okay.
So I don't think that's the reason. I don't know about that particular.
So early onset of cancer. Go ahead.
Yeah, and we've seen it actually across a few cancers. So colorectal would be one, breast would be another one, kidney, pancreatic cancer. So it's a bunch of cancers. There are others as well, where you see relatively young adults. So we're talking about younger than 50.
Yeah, I have a friend who was just diagnosed with terminal kidney cancer.
I'm sorry
stage
to hear.
4, and it's awful, no detection. But like, how would he have known?
So I'm just
he's like in his early 40s.
So again, you asked about necessary versus unnecessary. So I just want to establish that there is a need for early detection, even earlier than what we thought.
I hear that.
In terms of the age of the patient. But even if you just adhere to the recommended screening schedules, people are not getting tested by the masses. So you have to ask yourself, why are they not getting tested?
Yeah.
So we did a bunch of surveys. And actually, there's data available online that other people performed where you see what the barriers are. And it's different for different cancers. So, for example, for breast cancer, where you have a high adoption rate, and I should explain what adoption rate means. It means how many people out of the eligible population are actually getting tested.
Mammograms.
So let's say mammograms. It's a recommendation above the age of 40 right now in the U.S. You actually can go younger if you have additional risk factors. So it could be certain mutations like BRCA. It could be direct family history and so on. And also it actually influences the frequency by which you need to take those tests. So even there, where it's relatively high, we're talking about around 75% adoption rate. So there's more way to go to push this number up.
Mm-hmm.
For other cancers like lung cancer, the adoption rates are abysmally low.
Right.
So we're talking about, I think the national average in the US is like 5%.
No awareness.
Yeah. So awareness is definitely one of the barriers.
Mm-hmm.
Access
Mhm.
is another barrier.
Okay.
Just think about people who do not have like primary care physicians,
Mm-hmm.
for them to get a recommendation from, or maybe they just live in a rural area,
Yeah.
just not in a, in a city.
Why and how are they getting this mask?
So we want to get to the people through online marketing.
Just plain online direct-to-consumer marketing.
Yes.
Say, here, take a mask, breathe into it. You may have cancer.
No. So obviously, when you do this type of campaigns, you know how to target your target population.
Yeah. But why do you think that people are just going to say, okay, send me a mask?
So obviously,
I feel like you're not answering the question.
No. I'm getting there. Sorry if
Yeah.
I'm trying to. I'm not trying to evade the question.
Yeah.
Not at all. So yeah, you want to educate the people, obviously.
Yeah.
Online is one of the activities we're going to do. Other activities are going to be physical lectures in the communities.
So people who have no idea they think they have cancer, they're going to turn up at lectures to find out that.
So
maybe
no,
they stick a
there
mask
are
up.
actually a lot of events. So just take breast cancer for example. You have a few in the US. It's pretty great. You have a few advocacy groups, large ones who have
American Cancer Association, for example.
But that's not specific for breast cancer.
Oh, right, not for breast
You
cancer.
have, for example, Komen. You have Force in New Jersey, New York area. You have something called Shosheretz. So
you also have like these like pink days where the people, like even the Yankees wear the pink baseball hats.
So something like that.
Right.
We did one actually. So October was Breast Cancer Awareness Month.
Yeah.
So we did an event already.
And people took masks?
So
because you're not selling it, I mean.
Yeah. But we actually recruited people to the clinical study based off of this event.
You can give it out at baseball games, I guess, also, or something like that.
That could be another option. I should talk to you.
How much are they going to pay you for the mask?
So the starting price for our kit is going to be $250.
$250. And how often am I going to do this?
So right now we're going to adhere to the recommendations, which would be a yearly test.
Yeah, so once a year, buy a mask, pay $250, breathe into it, send it to our thing. We'll let you know if you have cancer.
Yes.
Okay.
And now as we grow the company and we add more cancers, you can actually check more boxes. So you can decide, I just want to do breast. Maybe I want to do more. Maybe I want to do breast and lung, colorectal, and others. As we go along, we'll add them to the list. By the way, from the patient perspective, you just have to breathe once into the mask. It's not going to change kind of their basic experience.
By the way, when the dog sniffs it, does it know the difference between breast cancer and colorectal cancer or whatever it is?
That's a great question. So when we started the company, we actually trained the dogs to be kind of horizontal.
Yeah.
So we actually trained them to sniff the common scent between the different cancers. Okay. Which was great, by the way. We actually trained them to sniff for cancers, but when we introduced new cancers that we're not trained for, they could detect them at a pretty high rate, so around like 80%.
So there's a high commonality in the VOCs.
Right. The problem with that, it's a very common problem in multi-cancer testing. It's the tissue of origin. So you want to be sure that it's not only that you have a positive signal, you can actually trace it back to the source of the tumor. Does that make sense?
I mean, to someone who knows what they're talking about, it probably does. But for an idiot like me, it's harder.
So just say we take the Grail test, right? It's 50 cancers.
Yeah.
So let's say it comes out positive.
Yeah.
But now you have to make sure where the positive signal came from. Okay? And that's a whole new ballgame.
Okay.
So when you train them to sniff horizontally, there is always a chance that maybe they're sniffing one cancer over the other, and you're not sure what's the origin tissue. So that's why we decided to kind of change course in the way we train the dogs. And now we have a dedicated pack for each cancer. And I saw it with my own eyes for the
dedicated pack of dogs.
Yeah.
Interesting.
Pack of dogs is 4 dogs.
4 dogs, okay.
Basically per cancer.
So this is the breast cancer sniffing dogs, and these are the lung cancer sniffing dogs, and these are the colorectal cancer sniffing dogs?
Exactly. And I saw it with my own eyes. I think for the first time, I don't know, I haven't seen any other papers around that where a dog would sit for a positive breast cancer sample and would ignore the positive lung cancer in the same sniffing event. Yeah. So that's amazing. That's, I think, for the first time done in history. And it goes to show that they're identifying a very unique unique signature of VOCs to that particular cancer.
That's actually incredible.
Yeah.
Before we go on to the next question, I want to ask you, I got emotional in the middle of talking about my friend Ty, who was just diagnosed with kidney cancer not long ago. So Ty, this one's for you. The reason we got to make this company work is for you and for everybody else that loves you out there. So hope you're listening.
Thank you.
Where did the idea come from that dogs can sniff cancer?
So actually, one of our founders was the head of canine unit. And he's not
The canine unit
in the IDF.
in the IDF. Yeah.
And I think, he saw their amazing sense of smell. Remember, we trust dogs with our lives, right? We see them at airports. They work with the military and the police. They sniff all
Explosives.
explosives, drugs,
Bodies.
but missing person.
Missing persons.
Just think about the missing person for a second, right?
Yeah.
We give them like a piece of cloth of something they never came across with, right? It's the first time they come across this scent, and they can sniff a person from miles away.
Mm-hmm.
So I think he kind of saw the potential here, and he said to himself, why not, healthcare? Why not identify different diseases? And by the way, we started with cancer, but that doesn't mean that it's limited to cancer. We've seen a lot of papers that came out recently. There is a growing body of evidence, I should say, for other diseases as well. So
The dogs can sniff other diseases.
yeah.
Mm-hmm.
You have a bunch of neurodegenerative diseases like Parkinson's and Alzheimer's. They already can sniff seizures in advance.
Wow.
They help
This is research you're doing, or
no, others are doing. They help diabetic people. They can also alert to different conditions. So
the idea of the guy who runs the canine unit, is one of the founders of the company, is if dogs can sniff explosives, they can sniff cancer in advance.
They can
too.
sniff anything.
Anything.
Yeah.
And so how'd they settle on cancer?
So I think maybe it was close to the heart of. Remember,
Everyone in Israel thinks 8,200 innovation. I don't think anyone thought that out of the canine unit of the IDF,
yeah,
which sniffs explosives and missing persons and people and terrorists. You'd say, okay, let's cure. Let's at least diagnose cancer. I think.
Yeah. So
pretty amazing.
yeah, it's very creative.
Yeah. What's his name, by the way?
Ariel.
Ariel. Okay.
And he put together an amazing group of people.
Mm-hmm.
The other founders are coming from different backgrounds, different walks, kind of tech and
Mhm.
marketing, and also the team in Israel. I mean, I just came from the lab. They're just an amazing group of people. Very unique, diversified group, right? So you have the dog trainers, the dog people,
the dog trainers,
dog trainers, the dog handlers, right?
Where do they come from? They also come from the canine unit of the IDF?
Not necessarily, also, but not necessarily. You know,
Okay.
you have a lot of just civilian, I would say,
Okay.
dog trainers
Good
as
with
well.
Dogs. Yeah.
So they know how to work with dogs. Also, putting them together. So remember, the dogs have to live in a kibbutz together.
In the kibbutz.
Yeah.
Okay.
And they hang out together. So you have to make sure that you pair them correctly. And they have to be in a good mood, right? Like us. If you want to function well, you have to be happy. So we have to keep them happy. And then we have the other side. So we have the wet lab, the lab technicians, the biologists, the chemists. You have people who understand the science of scent, which you have to know a lot about in order to make this happen.
Where do those people come from?
So they actually are veterans of the electronic nose. So, it's been, 3 decades maybe of electronic nose research. And I think they saw the potential with the dogs, because just to give you a sense of the difference, right? So the dog's sensitivity, it's part per trillion. So they can sniff one part out of trillion parts.
Wow.
That's insane. So just if you take like a half a spoon of salt or sugar, put it in an Olympic swimming pool, they can tell the difference between these two different pools, right? So that's 3 orders of magnitude better than any artificial instrument.
And what about human nose?
So we used to be good sniffers. The reason why I say that is the most frequent gene we have in our genome is actually genes for olfactory receptors.
Mm-hmm.
But with evolution, we are much more reliant on our eyesight. So we have a relatively really good eyesight compared to other mammals.
Yeah.
So with time, we kind of inactivated So a bunch of these genes are actually inactivated.
So we used to be as good sniffers as the dogs?
I don't know if I don't want to make those type of
I'm just
comparisons.
checking. Yeah.
But I should say it's not just dogs. A lot of mammals, as much as I love dogs,
Yeah.
a lot of mammals have this amazing sense of smell because they need it. They rely on it to survive. So
But it's hard to get a dolphin to sniff sniff a mask.
Yeah,
That's hard. Okay.
that karma also to take them out of the water.
Okay, so you're saying you've got the chemists, the dog trainers, the dog keepers.
You have the engineers, so we have
engineers,
all the hardware, kind
the
of
chemistry guys. Yeah.
the chemistry guys. We have data scientists as well.
It's a very diverse team. You're right.
Yeah, and you see it like in the office. You have like the people with sandals, that are the dog people. You have the people working on the computers. So it's a very diverse group and amazing group of people. I mean, remember, at the end of the day, that's what would make a startup work. If you have a great team and a winning team, and that's what we have.
You kind of launched this company to say dogs are going to sniff cancer. I imagine most people looked at this and said, "Nah."
Yeah.
Here comes Elizabeth Holmes again.
Yeah.
So how much of a challenge was it, especially given the Elizabeth Holmes Theranos background, to raise money for this crazy idea?
I want to start actually with my story. So when SpotitEarly first approached me, it was around, almost 3 years ago now.
Mm-hmm.
I said no. I am a molecular biologist by training. I'm a skeptical person. And, I know how noisy, biologically speaking, cancer is.
Yeah.
And I told them, like, I don't think it's going to help if you're going to add another layer of variance, right? But as it happened, they just completed the interim results of their clinical study. And when I saw the numbers, I was like, okay, I'm an evidence person. I cannot ignore what I'm seeing. And it just clicked. And I got hooked, and I'm obsessed with the company actually ever since. And I keep seeing the information, the results kind of coming in. So I feel like remember our collaborations, by the way, I mentioned Hackensack Meridian Health. We also have an agreement with the University of Pennsylvania.
Mm-hmm.
Hopefully we can kick off the study with them as well. We actually have a separate grant with them to figure out how to sell it in collaboration with the hospital. So kind of identifying the clinical utility, the intended use of the test. So they're helping us with that. We got $1 million grant from the Bird Foundation to do just that.
Yeah. I'm sitting here thinking about it, by the way, $250 for a test once a year that lets you detect stage 1 cancer, even pre-cancer, is actually way cheaper than what it would cost to treat somebody.
Oh, yes.
With it. And so it's actually not a big deal, except that the consumer has to pay for it rather than the
for now,
medical system.
Yeah.
I'm just thinking about that now. Okay.
So
keep going. Okay, so you got here and you got convinced.
Yeah. So I just want to talk about a little bit about the trust that you need from the medical industry, from the health systems, from the hospitals. So I have to say it's very easy for me right now because I went through the same process. So when I first talked to the the professors, the radiologists, the oncologists, they start off very skeptical, but then I showed them the paper. I showed them the actual results. And I think they transform like this. The conversations are very, they're flowing. We already, I told you, have a bunch of signed agreements. And I think they just understand how big of a need it is for early detection. And, they know that what we have right now, it's not good enough.
Yeah.
And they're looking for innovation in this space.
And they say, dogs, no problem.
Yeah,
Must be skepticism about the dogs.
I mean, there might be some, but again, the proof is in the pudding. They are willing to conduct those clinical studies together with us, so they have skin in the game.
So you're a scientist and not a commercial guy.
Yeah, that's true. For 15 years ago. Is that
beneficial or a drag on being the CEO of this company?
No, I actually, in this particular case, I think it's a benefit, and I'll explain why. When I just came out of university, I was an ideologue, I guess. I just didn't understand. Why can't you just have a great idea, just take it to the market? Don't worry about the economics and all that stuff. Just get it to the people, But in reality, as much as we all would love to, get everything for
Hand
free,
it out for free, yeah.
And that's been a trend recently. If you really want to help people, you have to build a successful product. Because people are ideologists so long as it doesn't touch them. What if I tell you that, listen, This month, you're not going to get a salary, okay? Just do it for the people. No one is willing to do that. So I think,
Some people are.
most aren't.
Okay.
So if you have to do both, if you want to help save lives, you have to build a functioning, profitable company, and that's what we're trying to do. We're trying to do both.
How much money have you raised?
So far, 20 million in seed money.
Total of 20 million? The
Yeah.
whole company so far, that's it?
And now we're hopefully in the very near future finish up round A.
Okay. How big is that?
Additional 20 million.
Okay.
Yeah.
You've been pretty capital efficient until now.
Yeah.
Dogs don't cost as much money as human beings, I guess.
So, I mean, it depends. I think relatively speaking, we didn't still make the big jump, right? The scale jump. So that's still ahead of us. But we'll need. So those clinical studies are not cheap. We have to finance those and also growing. So we want to open a lab in the US, want to grow in the US. That takes money.
What about getting to consumers? I'm sitting here looking at this mask and saying, how the hell is this getting to the hands of the people who need it? So it sits in their medicine cabinet, or so they walk into a CVS and they say, okay, give me that. Oh, $250? Ugh.
So yeah, as I mentioned at the beginning, we're not going to approach all of the population.
Yeah,
it's going to be very targeted.
Rich people who pay $250.
Not necessarily. I guess it's kind of middle class and above.
Okay.
But remember, there's a whole marketing team.
Yeah.
It's not just me, thankfully, that's working on it. So
you live in New York?
I live in New York metropolitan area.
Okay,
Do you know
so
what
like
it
Mom
means?
Donnie going to make this $2 a mask?
So wait.
Yeah.
I live in New York metropolitan area, which means New Jersey.
New Jersey, okay.
Yeah. So it's a bit different over there.
You can be able to charge $250 for this in Mom Donnie's in New York or not?
So actually, a small anecdote, typically diagnostics company and screening company, they don't start with New York and California.
Uh-huh.
They start with the outer 48.
Why?
And they graduate.
That's interesting.
They have unnecessary heavy regulation.
Uh-huh.
So, I'm sorry, for the population there.
But really sorry to New York and California. You will not be able to detect your cancer early.
At the
You'll have to
beginning.
move to a different state.
You said that. I'm not.
You're in New Jersey. It's good for you.
Yeah.
But, yeah.
But in the future, we want to go there as well.
Uh-huh.
Yeah.
All right. So one of the things I'm trying to get my head around is, and I think you've said this before, that you're combining AI with AI, artificial intelligence with animal intelligence.
Double AI.
And one of the things I've actually been curious about, because I always talk about AGI, right, which is general intelligence, similar to human intelligence. And I'm sitting here thinking about your metaphor that if you put a half a teaspoon of salt in a Olympic-sized swimming pool, the dog can tell the difference between that swimming pool and a regular swimming pool. I'm saying to myself, can AI ever get to the level of biology of these animals, human or dog, as the case may be, that have these just incredibly developed senses and that AI really doesn't have?
So we have to separate the software from the hardware.
Yeah.
Okay. So there's been a lot of developments around the software, and that's, I would say, the AI part, right? And it could do magic.
Yeah.
We apply it in a certain way, but other companies are applying it in different ways. Just as an example, also from our field, being able to scan for millions of just X-rays, simple X-rays, can help radiologists make like better judgment calls, right? So, and this is again image processing. I don't think that AI can be replaced. I think it's coming. So right now it's assisted, but at some point AI will just do a better job and we'll trust it more.
Do a better job of what specifically?
So image processing.
Image processing, okay.
But again, that's software. When we're talking about scent,
Yeah.
you have to use hardware. You have to actual sensors. So that there's a limiting factor there. So no AI capacity can help you if you don't have enough input, if you don't have enough
Is
data.
the dog the hardware or is the sensor the hardware?
I'm talking about just the scent itself. By the way, the dogs have both. Why do they have both? They have, first of all, they have hundreds of millions of olfactory receptors in their nostrils. On top of that, they have a small organ called the olfactory bulb. It's in their frontal cortex. And this organ helps them to parse out the signal from the noise on real time. So if you ever walk the dog, you see that they're just like us, they're kind of scrolling through sniffing, right? And they have to look up information. So, this dog was peeing over there and maybe it had something bad to eat or something like that. And this one is pregnant. And you just collect all this information, but there's kind of an onslaught of smell and scent coming their way, and they have to kind of decipher what is it that they're sniffing.
I'm actually going to go with that analogy. I've never thought of an Instagram scroll as pee and having bad smell and dog duty.
I hope they sniff other stuff as well.
The dog smell. If sniffing is like scrolling when you're walking in the street. I actually like the analogy, especially for TikTok.
Yeah. Oh yeah.
Yeah.
Sure.
That's a lot. I don't know what that is, pee or whatever it is, but it's
fake pee. Maybe there's fake.
It's
pee
not.
there.
I'm not sure it's fake. It might be real. It smells really bad. The TikTok feed. Yeah. So the dog is not replaceable really by AI, but what are other biological sensors you think we can use that are like underappreciated right now?
So first of all, I told you before there are mammals with amazing sense of smell to the same extent of dogs. So
what's the most competitive one to a dog?
A bunch of them. So mice, rats,
Okay.
They have amazing sense of smell. By the way, there is a company who's using mice. I think, maybe the pitfall there would be their short lifespan.
Yeah.
So you train them, but then they die after 24 months.
When was the first time we understood that dogs can smell disease?
Oh, a long time ago.
How long?
So as far as I know, like over 100 years ago.
And who was the person who invented that?
I don't know if there's like an invention. There were reports. And by the way, still you get anecdotes from people who would say, my dog sniffing like weirdly a few years before I was diagnosed, but I felt there was something there.
Wow.
So we get those anecdotes from time to time.
The reason I'm
as
asking
well.
the question is I'm thinking about the branding of the car and Elon Musk calling his car Tesla.
Tesla, yeah.
I was thinking that SpotitEarly could find the first guy who
Don't
invented
know
the
that
dog
there is
smelling.
one.
It's not just one guy, huh?
I don't think so.
Uh-huh.
But yeah, it's a point for us to. We'll look
right.
it up. We'll look it up. It's a good idea.
That's what I was thinking.
Maybe it was Tesla.
Why did you launch in Israel before you launched in the United States?
You have to graduate to the United States. And also Israel, it's kind of a hub of innovation.
Mm-hmm.
So we're great at coming up with
Mhm.
ideas. When it comes to scale, it's
Mhm.
harder for us to do it here. First of all,
Mhm.
there's less money here than in the US.
Yeah.
And also, the US, we call it's.
Why not just go to the big market first? I mean, many companies just go to the big market first.
So again, it's a question of where the innovation is coming from,
Mhm.
and I think that there's a concentration of healthcare innovation in Israel. By the way, we have a lot of Americans taking interest in Israeli companies for that reason.
But this is not really healthcare. This is something else. This is like the market is healthcare, but this is like you said, it's like chemistry and dogs and sniffing and
For sure.
AI and sensors and it's like classic Israeli multidisciplinary on the science side, but I'm
Right.
more interested in the market side.
But again, to develop the actual capability before you scale, Israel is actually it's a great place to do it. First of all, you have a lot of grants, accelerators here. So to start something, I think it's actually better to do it here. And also, you have a lot of people who have this drive, right, to innovate, to start something new, all kind of concentrated in a small place.
How many times a week does somebody call you and say, "Send me a mask"? I want to know.
3 times a week.
Do you do that?
No,
Why not?
because we can only say compliance and regulation.
Yeah.
It's very. I'm not selling shoes here, right? So I can.
What's the big deal? So give me a mask. I'll send it 90%. And then you send them for a blood test or a mammogram or colonoscopy.
Have you ever heard of liability?
So it's lawyers. I'm just sitting here thinking about this. Like, this should be a no-brainer, right? Just like I went in and put on a mask because it had no cost, basically. This is $250. I get the point. To stop COVID from spreading. Just give it to me. What the hell?
Yeah, so we still, again, this is a cancer test. By the way, when I said we are selling direct to consumer, that's only half true. So every time you're feeling...
so the whole first part of this thing we have to erase because it's only half true?
No, I'll add the information. You can edit it back if you
Okay,
want.
go ahead,
I think you guys can do it.
Yeah.
But on a serious note, when you fill out the form, if you want to order the test, it actually goes to a physician. So it needs
This has to be prescribed by a physician?
It's a cancer test. It's not a COVID test. It's not something.
So I can buy a strep test at CVS, no problem.
Yes,
right? Rapid strep test, and I can buy a COVID test, a rapid COVID test, which is going to keep me at home for 5 days.
Yes,
at a CVS, no problem. But I can't buy a cancer test.
Go to CVS now. Do you see any cancer tests on the shelf?
No, I've never seen it, but I'm trying to understand why.
It's because it's a more severe disease. There are different regulations and rules.
Should I want to know about it before?
Yeah, but again, the ramification of getting a cold versus diagnosing cancer It's just
What if you said a disclaimer that this is only 50% accurate, but if you want to do it, turn up for a blood test afterwards?
I mean, you have to talk to RFK and ask him all these
mammogram.
questions.
If RFK is listening, we'll just tell him this is something you should do to prevent people from getting cancer, and you'll save a lot of money for the U.S. health system.
Yeah, that we can go there.
No, but I'm asking a serious question. So,
Yeah.
where in the world could you go today and like put these boxes somewhere and say, okay, pay us $50 and take a test?
Even
make
if
sure
you
don't
go
get cancer?
elsewhere. So, we had conversations in Europe, Southeast Asia, South America. There's still some regulation when it comes to cancer.
What's the most forward-thinking market?
For us,
Yeah, I mean, this should be a no-brainer.
yeah. So
Yeah.
outside of the US, I'm not even limiting myself. It could be Central South America, Canada obviously would be
Yeah.
easy, Israel and the Middle East, Southeast Asia. I mean, these are all
If you, had,
conversations we're having.
you have a 20-second message now to RFK, what is it? Hey, RFK.
Hey RFK, help us, make this dream come true. And if we can,
He doesn't want to make your dream come true. He wants to make Americans healthy again.
yeah. So relax. If we can relax a little bit of the constraints here, I think
Why?
we can get it. So
Convince me. I'll be RFK. Convince me.
because you can save people's lives and a lot of money in the process.
Okay. Just for a
detecting-
mask.
Yeah, just with a mask, detecting cancer early, so you don't have to go through the whole process of getting diagnosed with multiple tests and then having, painful treatments.
Yeah, that picture wasn't
Costly.
crisp enough. Try again. To RFK.
I started with a crisp one-liner,
All right,
right?
go ahead.
Save lives,
You need to
save
make
money.
my dream come true.
Oh, you're right.
Yeah,
save
okay.
save lives, save money would be my kind of
Save
one,
lives, save money.
Yeah.
Relax your regulation. This is just it's just a mask.
right?
You didn't like the COVID mask, but these are 3-minute masks.
Yeah. That's important to note. I know people have some
So
feelings about it.
you got your PhD at the Weizmann Institute.
Right.
In cancer research.
Mhm.
What was your thesis on?
So I focused on the interaction between the tumor and its microenvironment.
Mm-hmm.
Back then, by the way, it was mostly kind of academic.
Mm-hmm.
After I left, obviously, it started booming. So I don't know if you heard the term immunotherapy,
Mm-hmm.
cell therapy, gene therapy. So basically, what it means, you don't only focus on the tumor itself. You understand that it grows kind of not in a vacuum, but rather it interacts with whatever it is. It could be supporting cells, what we call fibroblasts,
Mhm.
the immune cells, and you can actually activate the immune system to attack the tumor, which is what's going on with the new surge of drugs. Actually, that's one of the reasons why you see this innovation following of early detection, because once you have more treatment, you have to have treatment options for the early detection to matter,
Mm-hmm.
right? Right now, if you tell me early detection for Alzheimer's, I would say it's nice, but it's not really helpful because we don't have a cure for that.
Mm-hmm.
With cancer, it's a different ballgame. What we have right now, we didn't have 20 years ago. So there are much more, options on the table for patients.
So correct me if I'm wrong, but when the Iranian missile strikes happened, it hit actually the cancer labs at the Weizmann Institute. Is that right?
Yeah. So, that was it was a hard time at the Weizmann, but I do have to say they were very resourceful. I mean, they immediately managed to find like other areas, other places, kind of rearrange some of the things there. It's true that one of the cancer research buildings was got a direct hit, but also it spread across multiple buildings.
Yeah.
It's not as if we're just going back.
How do you think about
20,
that?
30
Like
years.
probably, I'm guessing, but like a decade plus of research probably went up in smoke, right? You think about how many diseases could have been cured had it not been for that missile strike?
Yeah, I mean, that's one way to look at
Yeah.
it. I think it also, so I talked to a few professors and researchers
Mhm.
from the Weizmann. It also opens up like opportunities for innovation. It depends how you look at it. Of course, there's damage, and some of the things cannot be salvaged, and some of the research, is gone. But also, nowadays, we keep a lot of things on the cloud.
Right.
It's true that the biological samples themselves, some of them at least are gone,
Yeah.
but some of the information would still live on the cloud. So
I love your positive attitude
You have
towards
to.
it. Somebody mentioned to me that your PhD mentor was very meaningful.
oh yeah.
And tell me more about her, right?
Yeah.
Yeah. Yeah.
So her name is Professor Varda Rotter.
Mm-hmm.
She was one of the discoverers of a molecule called P53.
Mm-hmm.
P53, it's a protein, what we call a tumor suppressor.
Mm-hmm.
So it helps protect our bodies from tumor formation. It's what was termed the guardian of the genome.
Mhm.
So she was one of its discoverers, and throughout her career, she managed to take this little protein and kind of provide different angles. So cancer was probably the strongest one, but with as the years went by, we found in the lab that it actually it influences a lot of other biological processes. So she had multiple discoveries like that. She really helped patients eventually with her research throughout the years. And she created also an amazing lab. So she was a leader. She could bring people together. I remember at the Weitzman, the band, don't let me fool you. There's actual smart people there, and it's hard to bring them together towards achieving those different milestones. So she was a great leader, and yeah, I have a lot of appreciation for her.
And what kind of culture do you want to create at Spotted Early?
So I would actually, inspired by Professor Rotter, I would say that's exactly the type of energy I want to bring to the company. So I think it's true for every startup. You have to be united, but what the company is trying to do, I think we have two main advantages. One, the fact that we're actually trying to help people, and that means a lot. There are easier things that we can do. Why do I need this headache? Like I just told you, cancer, it's heavily regulated, and it's hard to introduce a healthcare product into the market because of that. It takes years. It's hard to raise money. You mentioned it before, but it's meaningful because at the end of the day, you can actually save lives. I know maybe it sounds a little bit tacky, but
not tacky. It's important.
When you wake up in the morning and you have it in the back of your mind, I think it matters. So that's one thing. The other thing is the dogs. So I know you mentioned you're not a dog lover. I think there's a therapy for that. I think we just need to give you a dog.
Dude, no, my kids actually did, just so you know, like my kids nagging me to have a dog. I didn't want to have a dog. They brought it to the house for I don't remember how many days, this dog. And of course the kids said they'd take it out. That never happened or rarely happened.
Yeah.
Thankfully the dog only made it in our house for 8 days. I thank God I have 8 children. I don't need something else. I'm busy enough. You know what I'm saying?
You got it covered.
Yeah.
But there are a lot of
and also, by the way, I sneezed when the dog was in the house, so we're done.
If
they
you're
said it was
allergic.
hypoallergenic. They said hypoallergenic, but it's like, come on, give me a break.
So okay, they are hypoallergenic.
My kids come to Spot early to pet the dogs because I won't let one in the house.
So listen, my daughter, she's actually allergic to dogs, really allergic.
Yeah.
So she took Zyrtec before she visited the lab, and still she got puffy eyes and everything.
Mm-hmm.
And we got a hypoallergenic.
But it's about the dogs. Yeah, you got it under control. Go, sorry. Go ahead.
Yeah. So, but we got a hypoallergenic dog, and she's doing fine. I'm just
Amazing.
saying. Okay.
Yeah.
So it could be in the cards
Enjoy
for you.
it.
And also, there are a lot of videos right now on TikTok and other social media where they show typically like grumpy older people. They say no to a dog, and then they force them to adopt a puppy, and then they show like a video like a few months in, and they're just in love with the dog. So.
You calling me a grumpy old man?
No, not necessarily. I'm just saying in the video, that's what you see.
I'm just saying you watch TikTok, which you called piss and cocky before. I'm just pointing that out to you.
I actually don't have TikTok, but
okay,
whatever.
just checking. So, we can tit for tat. If you think I'm a grumpy old man, I think, you're like the dog. There's a great Hebrew expression, like Kelev HaChozel Kio.
Yeah.
The dog, it goes after its own puke.
Right.
I'm just saying.
Yeah. I take it.
Yeah, okay.
So
let me ask you, so you said that, it really inspires you to get up and save lives. So I need to ask this question. $250 a test if what you really want to do is save lives?
Again, what's on the other side? That's the big question. And with time, hopefully, we'll be able to reduce the price and also get insurance coverage.
Mm-hmm.
It just takes time.
If RFK Jr. came to you and said, okay, not $250 for the test, $25 for the test, but you can go to market tomorrow, do you do it?
I will need the insurance to pick up the difference there. Yeah.
Okay. What does it cost you? You probably may not want to say this, but
yeah,
what does the kit cost plus the postage?
So right now, it's
not cheap.
Yeah,
but the mask.
No, it's not just the mask. First of all, you have to offset for all your developmental.
All the development costs.
Yeah,
you have to pay for the dogs too.
The dogs and also setting up the lab. But with time, you offset those costs.
Mm-hmm.
And actually, the test. Hopefully, we can. Once we open the lab in the U.S., we'll save on the shipping costs and things like that. So we'll try to bring it down with time.
What's your core value in life?
And again, maybe it sounds a bit tacky, but for me, it's just really try to be in the moment. The past already gone. The future, it's a concept, and many of it happens to me also on a regular basis, right? That you kind of dwell on what happened, and maybe I should have said this, that, or the other thing. Or I worry about the future. When you do that, you don't get to enjoy, what we're doing here. You don't get to enjoy, a company like SpotitEarly and what it does. So I really try, and again, I have to remind myself multiple times a day. I meditate a lot in order to do that. But I think that's, if you want to ask me what's important, I also try to instill that with my family, with my friends and kids. Let's try to have this moment together. Let's put the phones down just for this meal that we're having or whatever experience that we're having, because that's what you have left eventually, this moment.
To wrap up, I have like investors on the show and CEOs and scientists, etc. But I think it'd only be appropriate. I'd like you to tell us about one of the dog trainers who are like real heroes in this story. So tell us about one of the dog trainers. Feel free to mention their name. I'm trying to help people understand what these people are doing and who they are behind the scenes.
Sure. So actually, I met one of them yesterday. We had kind of a gathering not so far from the kibbutz. So I want to mention.
It's an actual kibbutz. It's not just a dog kibbutz. It's an actual kibbutz.
Yeah, other people live there, not just the dogs.
Not just the dogs.
Yeah.
Okay, yeah.
We have a few employees actually
Okay.
that are part of that kibbutz as well. So one of the trainers, his name is Itamar. And I just learned that he's doing more than that. He's a really amazing cook. He had some experience with that as well. And he's actually taking care of lunchtime at the company. And last summer, I visited for the first time with my family. I visited the kibbutz. Like I mentioned, one of my daughters is allergic. I have two other kids. They're not allergic, by the way, but they love dogs. We have a dog. We always, been fond of dogs. But he kind of guided us through the whole experience. He's very patient. You can see how people are good with kids, are also good with dogs. I don't think it's by coincidence.
Mm-hmm.
And just very professional, very nice, doing, God's work in training those dogs.
What's his background?
I think maybe it was, I don't remember. I have to say. I know it was a dog trainer, but I'm not sure if he did it in the army as well.
Interesting. Shlomi, thank you.
Thank you
Thanks
so much.
for doing this.
Thank you. It was great.
If you enjoyed the podcast, please rate us 5 stars on Apple Podcasts and Spotify. And make sure you watch this episode on YouTube, because there'll be B-roll there of the dogs sniffing out cancer. You're not going to want to miss it based on what Shlomi said. Thank you for joining us.
Thank you.